can see. Hi. Thank you so much for the opportunity to join you here today and be part of this annual scientific meeting of the Immunisation Coalition. I'll start by adding my acknowledgement of the traditional custodians on the land that we are on today, the Wurundjeri people, and pay my respects to elders past, present and emerging, and extend those respects to any Aboriginal and Torres Strait Islanders here with us today. I'm super pleased to speak on behalf of the Australian Centre for Disease Control and provide an introduction to the role and functions of this new agency, which Professor Kidd gave a flavour of in his remote hello just then by video, and at a headline level to talk about the new agency, but also making it as relevant to vaccine-preventable diseases and immunisations today and in the broader public health context we are in 2026. I know some of you in the room today have followed this journey very closely, and some others in the room perhaps only followed it at a headline level. And the Immunisation Coalition saw this as a really important opportunity for an early days update of the new Australian Centre for Disease Control. Professor Kidd gave a flavour in his video. The Australian CDC was established to monitor and assess public health risks, proactively work to prevent them, improve national public health data and analytics capacity, advise governments on public health responses, and prepare Australia for when another crisis occurs. And in doing so, the CDC takes a One Health approach to health risks, recognising the intersections of human, animal and environmental health. Now, the CDC's role is not to replace jurisdictions or policy agencies, but it is there to bring together data, expertise and analysis, distill what that evidence means, and provide independent and timely advice to governments and the public to support better health outcomes. I recognise that this agency becomes part of an already vibrant public health and healthcare sector and community in Australia, which is exemplified by institutions, coalitions, organisations, people and universities, many who are here today, and who are doing this every day, bringing together data, expertise and analysis to inform policy and practice and advance health outcomes. So what is the CDC at the most macro level there to do? The Director General, Professor Zoe Wainer, who was appointed as the first DG in December last year and who commences in her term in 2.5 weeks, is there as the DG of the agency to advise, consult and inform on public health matters. Public health matters is defined very broadly in the Act that established the Australian Centre for Disease Control, from health security to health promotion, prevention, health effects of climate change, by way of a few examples, deliberately broad. You can see there's a snapshot of 3 pieces of legislation outlined on the slide here, each relevant to the functions of this new agency. So it's under the CDC Act specifically that functions are outlined in more detail, although they remain very general, and I'll summarise them. The CDC's functions are to advise ministers, both Commonwealth and jurisdictional, on public health matters, on request, but also on our own motion. They're to gather and analyse information on public health matters, to consult with and advise a range of entities, to develop and publish guidelines and statements on public health matters, reports, information, public communications and education, and to promote the public health workforce expertise and public health research. In standing up, the CDC brings with it some functions that are already existing in the National Health Security and Biosecurity Acts, including determining listed human diseases and as the national focal point under the National Health Security Act. But this part is important. The CDC legislation is deliberately values-based. It requires the organisation in performing its function to have regard to 4 key considerations: the evidence base, the need for trust, that it's there to be earned, not assumed, the need for transparency. We have a legislative requirement to publish a certain subset of advice and a predisposition to publish the rest. This reflects an understanding that transparency is not a risk to public confidence, but a precondition to it. And the CDC must also have regard to the impact on particular groups, both the impact of public health risks and the responses to those risks, that reflects the understanding that these health risks are not evenly distributed, public health measures affect groups differently, and advice must take account of lived experience in addition and not just aggregate data. But these principles, to a crowd of clinicians, scientists and practitioners, may seem self-evident. But by enshrining them in the legislation, it enables the CDC not just to lift the expectation, but sets a new baseline for how we work. So what does the organisation look like? This is one of the questions from the coalition in the early days of setting up this talk. Now, this structure slide is not there so that you can easily see it's deliberately small, but it's displayed to give you so that you know that it exists on our website and it will be easy to find. But very broadly, there's approximately 250 staff across 2 divisions: a public health division with communicable diseases, One Health, climate change and the environment, and preparedness functions, and a strategy and operations division that do partnerships, communication, equity, data analytics, and some corporate functions. Our staff include medical officers, epidemiologists, public health officers, program and policy officers, data scientists, communication officers, amongst others. But what this structure does, it does 2 things. It enables a continuity of some national public health functions previously delivered by the department, now with the CDC, and it also serves the basis for new capabilities, including in pandemic preparedness, health intelligence, and data and analytics as examples. The CDC has a role to steward and act on some ongoing public health priorities in Australia. And this slide just shows a snapshot, some snips of the existing respiratory surveillance report, the 9th National HIV Strategy, the landing page of the National Syphilis Response Plan, and a picture of a recent article from CDI Journal. And they are illustrative examples to demonstrate some of the continuing public health priorities now led out of or coordinated with the CDC. And these also include, relevant to today, some specific functions including the enhanced surveillance of vaccine-preventable diseases, the delivery of public health programs, for example, to respond to the national syphilis outbreak, improving access to testing, treatment and diagnostics for HIV, BBVs and STIs, including in First Nations communities, and participation in existing health protection governance structures in Australia, AHPC, CDNA, PHLN. Further, with respect to immunisation and vaccine-preventable diseases, in 2026, the CDC will have an ex officio membership on a TAGI to enable the connection of the Public Health Agency to this group. We will manage the Australian Immunisation Handbook, the critical national resource for health professionals that provides up-to-date ATAGI recommendations endorsed by the NHMRC. And the CDC will, as an example, a project example in the near term, support the development of a national monitoring and evaluation framework to assess progress toward the goals of the National Immunisation Strategy from 2025 to 2030, which will complement the department's leadership in delivering the National Immunisation Program and advancing actions under the NIS, which I know David's speaking to next. So up to this point, just provided a very brief role and function overview of the new CDC with a bit of context in the legislation. And as the CDC continues and enhances its functions, including in the surveillance and response to vaccine-preventable diseases, we will continue to work closely with you, with the sector, with institutions, community, because it's these relationships which will be a critical part of the CDC's mission as part of the Australian public health landscape from now. And this final slide, just to think about why now, what's the opportunity in the current context, which I know is going to come up through the program over the next 2 days, day and a half, on some of the major challenges we have in continuing to boost the uptake of vaccines in Australia and globally. But, you know, that first and foremost in our context, not just on vaccines specifically, but global, regional and domestic trends in public health, trust in institutions, and the uptake and confidence of many interventions we've relied on for decades, exacerbated, again, by Professor Kidd had a hint in his video about the tide of mis and disinformation and vaccine scepticism. Many things are heading in the wrong direction. And so when you think about some opportunities in the very early days of a new CDC, I mean, first and foremost, the Australian government has invested in a new national public health capability. It's a timely opportunity in and of itself. The second opportunity, again relevant to some of the issues being discussed here over the next couple of days, is that commitment to boosting national public health digital data analytic capability, especially in areas which I appreciate, and we'll see demonstrations of this already happening, bringing together disease surveillance, immunisation coverage data, safety monitoring, behavioural insights, human factors and lab intelligence to enable targeted and timely action. The institution is charged with boosting the national public health data capability for real-time insights. And third, the CDC has an opportunity to build a trusted platform to communicate and to engage in public health. And this couldn't be more timely, especially in 2026 and on vaccination. And it's been mentioned already, but there's an array of excellent work already happening in this space, led by institutions such as NCIS and demonstrated by some of the work referenced earlier by Caroline from the Immunisation Coalition. And the CDC is a new player and willing partner in the space to build trust in how we communicate in public health. There are so many excellent presentations ahead of us, and so it's time for me to end so we can keep moving. We really appreciate the opportunity to present and asked to give an early days update for the Australian CDC, now 46 days old, but years in the making and at the beginning of some really busy years ahead. So thank you.